We're all about facts here, not fear, and providing information to keep you and your loved ones safe. Dr. Payal Kohli joins us live again to answer your questions about the coronavirus. But before we get to those questions, there's some new data, doctor, that is saying men are dying more from the coronavirus than women. What's going on here, Doc? Help me out.
So we first became interested in actually looking at the difference between men and women because of what we saw with SARS and with MERS. And remember, those are the closest cousins to this virus. And men were actually dying more frequently than women with those viruses, as well as with this one. And we're seeing the same pattern emerge here. And there's a few possible explanations. The first is that it's behavioral. So men tend to indulge in more bad behaviors compared to women. Things like smoking, not washing their hands, not using soap. And believe it or not, men are less likely to listen to public health experts than women.
Well,
are you listening, Jeff?
No, I don't want to listen to that, Dr. Kohli. No, I totally hear you. That makes sense. And welcome to the show. I forgot to say it off the top. So welcome, Dr. Kohli. We love having you. Thanks for being here.
So we're going to start.
Thank you. So a couple of other explanations. Well, before we move on, I just want a couple of other things. So the second possible explanation is that men may actually just have more medical illnesses, like high blood pressure, heart disease, or diabetes. And the final explanation is biological or hormonal. So believe it or not, estrogen actually plays a role in regulating immune function. And men actually have a slightly lower innate immune response to viruses like HIV and hepatitis C. And then the gene that actually is involved in this virus attacking your body lives on the X chromosome. And women have 2 copies of the X chromosome, and men only have 1. So these are all possible explanations for maybe why men are dying more commonly than women.
Wow.
I think that's so important for people to hear because, like, in my household with my husband, even before this happened, I would be like hosing him down in the backyard because he just doesn't think about things the way that I think about them. And I'm like, are you bringing this into the house? Like, don't, because now you're a carrier. Your bad behaviors are compromising the entire household. So when men aren't thinking about themselves, at least think about everyone else who is in the household and hose your husband down in the backyard. We're going to get to the first question.
Disgusting. What can I say?
That comes from Gene.
Did you hose Jeff down today before?
I did. I hosed him down too. I hose everybody down. Now our first question, it comes from Gene. He wants to know if homemade masks are safe to use, and if the mask is 100% cotton with 2 pieces, do they need a liner?
So homemade masks are safe to use, and they're actually better to use than nothing at all. But there are a couple of caveats I want you to remember. The first is that the fit has to be good on the face, because otherwise you're more likely to touch your face and adjust the mask, which increases your risk. And then the second caveat is that you can't give up on the social distancing. Just because you're wearing that mask, you can't stop social distancing, because really the point of the mask is not to prevent things from getting in as much as it is to prevent things from getting out. So remember, we're wearing these masks to protect our loved ones, to protect our community. And if we all do this, then we're likely to stop the spread of the virus, particularly those people that are asymptomatic and spreading the virus.
All right, let's get this next question. And Cecilia says she really wants to get her hair colored. She writes, I have so much gray. Would I be able to go to my hairdresser's house if she's cleaning and sanitizing every day? I think she speaks for a lot of America.
Yeah, Cecilia, me too. I want to get my hair colored, but unfortunately the answer is no. At this point, any interaction you have with your hairdresser is not only going to expose you to risk, it's going to expose her to risk. And even if she's not having any symptoms and cleaning the house, it's very possible that she or somebody in her house could be one of those asymptomatic carriers, which we're now seeing could be up to 50% of people could be asymptomatic with this virus. So either you got to embrace that silver, or you got to buy the box color, but do not go to her house right now.
All right, thank you, Dr. Kohli. I feel like I have a million more questions I could ask you. We have a limited time, but before we go, we want to leave everybody with some good news. The doctor's silver lining. What do you have for us today, Doc?
So today, you guys, we're going to do a historical perspective on all the pandemics. So as far back as we can remember, we've lived through many pandemics, and history tells us that each pandemic has left something positive in its wake. So the bubonic plague in the 1350s actually improved the living conditions for the poor. The cholera pandemic in 1854 improved the drinking water that we had. And the Spanish flu in 1918 improved the living conditions for many, many, many people around the world. So the COVID pandemic of 2020 is going to turn us from being a self-centered culture to being a community-centered culture, because everything we're doing, whether it's social distancing or wearing masks, it's not just about protecting ourselves, it's about protecting our entire community. So I think we're going to go from me to us, and in my mind, that's a huge positive.
I couldn't agree more with you, Doctor, because we talked about it yesterday a little bit. I hope we do learn that, and I hope now that we're fighting this common enemy, I told you yesterday, that we don't turn on each other once we do get this under control. So I love those. I love that silver lining, and thank you for being here all week. Dr. Kohli, you actually join us next week, too, so if you have any questions about coronavirus and you want them answered by Dr. Kohli, write into us on social media, or you can also email info@dailyblastlive.com. Remember, no panic, just prevention and precaution. Thank you again, Doc.